And Victoria, thank you so much for calling in to speak to us here this afternoon.
No
Talk to me about what happened to your dad.
Initially, it was about 7th of August. I sort of went to his flat and found him in a bit of a state. So I called 999 and they were there literally within half an hour. So, that was a great positive. They looked after him. They took him to hospital. And he had some stomach gastric infection that was causing him to be quite poorly. So they kind of gave him antibiotics and fluids, and that was all okay. And then I was told, your dad can go home, but he is quite frail, so he would need some sort of care package to go home with. And that never came. And this went on, and then he kind of got COVID a couple of times. He'd never had it before. He'd always been really careful, so that was disappointing. And then he got over that and again was ready to go home again, and then again, no care package. And then just before New Year's, he got like a proper flu. So he was isolated into a sort of separate room. We could still go and visit. We did sort of usual PPE and everything. And then the flu went to his chest. He got a chest infection, and sort of the first week of Jan, he developed pneumonia. And he passed away on the 6th of Jan from pneumonia.
Oh, well, Victoria, first of all, I'm so sorry for your loss. But just listening to all of that, your father was waiting for 5 months to be discharged from hospital. He originally went in with stomach problems.
Correct.
And then he died in hospital from unrelated matters from what you've been saying.
Yeah.
Talk to me about how that happened. You mentioned a care package and that wasn't able to be put in place. Now, I know what a lot of people may say to you, Victoria, just out of curiosity. Your father clearly had family, had you. He may have had other members of family. Why couldn't he go home? What kind of care did he need and wasn't being given by the NHS that made him stay in hospital for 5 months?
He needed very sort of intimate personal care. So he'd lost control of his bowel after having this gastric infection. So he was wearing sort of incontinence pads, sort of like almost like nappies, really. And he also had got very frail. He had a lot of muscle wastage while he was in hospital. He was having some kidney problems as well. He was kind of waiting to see his kidney doctor all this time. So they were desperate to get him home. So because there were other symptoms, he was quite anemic. There's other problems, just things that, unless you've got specific medical training, it's not something that just a family member could pick up. And he needed sort of care with everything, getting up, his personal care, washing. Where he lived wasn't really suitable, so that was another thing. But they couldn't get him moved somewhere more suitable until he was home, and then he could be assessed. So everything was kind of pinned on him getting home with the care package, and he then would have been moved to they call it like an extra care scheme, where they have nurses on site that live there. They have walk-in wet rooms, so his bathing would have been easy. He could have done that himself, but where he lived, he would have needed help with pretty much everything. I work full-time. I've got 2 children, so unfortunately I wasn't able to, give up work to kind of give him that care. And there's also, there's just things that I'm not medically trained to do. So I didn't really feel like I could have provided that for him. So he was ready to go home. I think it must have been about 4 times I got the call to say, Dad can go home, but we need to wait for the care package because he does need care, probably 3 times a day with his bathing just before bed, and also to come and sort of help him do some food. I could have done the lunchtime just to give him some food, but the other personal care, I just wasn't able to do that.
Yeah, no, Victoria, it's important to say that because obviously that is something that's said a lot when people say, well, why do you need a care package? You have a family that can look after you, and you've given us the bigger picture. It is not that simple. Ellie and Roy, you were nodding along to what Victoria was saying there. And Roy, I think you whispered to Ellie, we hear this a lot. This is a common problem.
It is. And Victoria, I'm so sorry to hear that story, but it encapsulates really the problems that we're facing now. And the NHS did its bit as much as it could. And then, of course, it can't look after people when they're in their own homes. That's the difficulty that we've got. Yeah. And so we look to our partners in care, which are organised by social services. What you were wanting was a package from domiciliary care. Domiciliary care and the care sector generally has about 160,000 vacancies at the moment. And getting the care packages in place is super difficult. And that means then, of course, that person is in bed in a hospital for much longer than they need to be. Something called deconditioning takes place where they get worse.
It makes you vulnerable to things like flu.
Exactly. And as much as the hospitals try to avoid that sort of cross-contamination, it's really very, very difficult. And at the heart of this, at the heart of most of the problems that I'm sure we're going to hear about this afternoon, is the Victoria example, where actually what we need to fix is social care. And I'm sure Ellie sees that every day in her practice.
Yeah, in your practice, you must hear that a lot from families who, you know, you're a first port of call as a GP, then that patient may go into hospital. And, you know, people always say it's difficult to get into hospital, it's difficult to get into GP, but actually it's difficult to get out of hospital.
Absolutely right. And people talk now about patient flow, so flowing from primary care with me through an ambulance, through a hospital and out the other side. And it's out the other side, as Victoria's described, into social care that is causing such a problem with people. And it's incredibly upsetting as well from the human point of view that this was, you know, the end of your dad's life, Victoria. And I'm so sorry that that's sort of how everything played out. And as Roy said, you know, hospital itself is not a good place for people to be. It's great when you're acutely unwell, and my hospital colleagues sort people out, but then to sit there and not to have family around and deconditioning, as Roy said, allows, unfortunately, this very sad end-of-life situation to play out. And what I think we'll also hear this afternoon as well is this story could have been different in another part of the country. We have a postcode lottery. There could have been a different social care issue somewhere else. There may have had better staff. And actually, it's not a homogenous system, and this didn't have to happen.
Yeah, Victoria, thank you so much for speaking up for your family, your dad and other families like you who are going through the same thing in the National Health Service.